MD versus MBBS, postgraduate, undergraduate programs, MD and DO. What are all of these terms? Check it out. Hey, what's up guys, and welcome to my channel. My name is Hafsa Sulaiman. I'm a third year medical student, and today I thought I would talk about some terms that are thrown around when you're looking at medical schools. So, first of all, for whatever reason, you're looking at medical schools all around the world, okay? So here's how you do it. You go to the World Health Organization directory and look at this. It shows you all the medical schools around the world that are accredited. And one extra tip, which is super cool, is that it tells you exactly what it means. Is it a 4-year postgraduate program? Is it a 6-year undergraduate program? What does it entail? What are the prerequisites? Who do you contact? It gives it all to you. Okay, so let's target some of these terms. I've said a couple of them. Undergraduate versus postgraduate. What are they? Okay, so it depends on where you are in the world. In the United States, an undergraduate is your medical degree, and a postgraduate degree is the postgraduate training or the residency program that you do after medical school. In other places in the world, for example, in the UK, if you're doing an undergraduate medical program, it's basically the first program that you do after high school. So it could be a 5-year medical program straight out of high school. And in Australia, a postgraduate medical program basically means that you did a degree right after high school. For example, me, I did biomedical science, and then you went on to do medicine. So that's your postgraduate program. This is another thing that can be super confusing when you're looking at different medical schools. 4-year versus 5 years versus 6 years. It's confusing. So the program that I'm doing at the moment with St. George University of London is a 4-year program. And basically in your first year, you're dealing, so the difference between a 4-year post-university degree medical program versus a program that you do straight after high school is the intensity. So you do it in 4 years, it's more intense, it's more fast-paced, and they assume that you're a mature student, you've already been through the university process, you're more mature, you are more resilient, you depend on yourself, and basically they rely on self-directed study. So rather than spoon-feeding you, it's slightly less spoon-fed, basically. So in my 4-year program with the St. George University of London, which is very similar to what you do in Australia as well, the first year is basically heavy on physiology. We do all of the systems, but it's kind of all bunched together. So you study human physiology, you study what goes wrong, you study the drugs, all in one, and we do it through a system called PBL. In second year, you study more about the conditions, and you study about the differential diagnosis, which basically means how to distinguish this condition from this condition, and what investigations would you perform to distinguish between the conditions. In third year, you talk more about investigations and also more about management. And finally, in fourth year, it's prescribing. How much of each drug, what's the dose? And that's just the basics. For a 5-year or a 6-year undergraduate / post-high school program, the advantages of that is that they ease you in the process. Each school differs from the other. Some of the 6-year or 5-year programs, they might start with the basics like chemistry, biology, physics. Sometimes in the 5-year programs that are done in the UK, you don't start with that. You start with biochemistry, microbiology, immunology, and then that goes on to basically what we study in the 4-year program. Another term that's super confusing, MBBS or MD. Why are they so different? So an MD is a doctor of medicine, and MBBS is a Bachelor of Medicine, Bachelor of Surgery. They're basically the same thing. The thing is, if you've studied medicine in a Commonwealth country, so if you studied medicine in the UK, you get a degree that's called an MBBS. If you studied in America or in Canada, it's called an MD. Now, to confuse you even further, if you've studied in Australia, if it's called an MD, it means it's got an extra research component. Why? I don't know, but that's how it works. Finally, a term that I've recently learned, MD versus DO. So DO is a Doctor of Osteopathic Medicine. These two degrees take place in the US, and both of them are essentially the same thing. So it leads you down the same pathway. Both MDs and DOs can prescribe medications. The only difference is that DOs also do an examination called the complex, which is kind of like the USMLE. They're both medical examinations. And Doctor of Osteopathic Medicine, they focus more on using muscles and skeletons to treat the human body. But anyway, I hope all of these clarified the terms. I really wished I knew the differences between them. It was really confusing for me. Give me a thumbs up and subscribe to my channel if that helped you out, and I'll see you next week. Bye.